Hi, my name is Michelle Trotter and I'm a Business Development Specialist here at Eagle. Every Friday, we're dedicated to answering any questions that you might have about the coronavirus. This week, we received a variety of questions regarding swimming pools, vaccines, and animals. We have Dr. David Hussong, who is our Chief Technical Officer, answering these questions for you. First question is concerning the coronavirus and swimming pools. If someone infected with the coronavirus swims in your pool, will the chlorine kill the virus?
Chlorine will kill the virus. It'll take a while, but the big thing is, just like any other bacterium or virus, just don't swallow the pool water and take care, shower off after you leave the pool. And if you're sick, stay out of the pool.
Next, if I take the vaccines for pneumonia, will it help me fight off the coronavirus?
Pneumonia vaccines are prepared against a carbohydrate in bacteria. It'll increase your antibodies to that carbohydrate on the surface of the bacteria. It should have very little, if any, effect on viral immunity. It will enhance your general immune activity, and that will enhance your response to just about any other infection, but in a very small way.
My wife is asymptomatic for COVID-19. Should she be taking antibiotics to get better? Should she quarantine? If so, how long?
So a concern that one's spouse is asymptomatic for COVID-19. This implies that she was tested and found to be infected with COVID-19. The only way that she would be tested and found having it would be if she was shown to be shedding the virus. The question then is broken down to, should she be taking an antibiotic? Generally, no. She could consult her doctor to see if she should take an experimental drug, but so far only an experimental drug is available. And we don't know all of the side effects of that. Talk to your doctor. It probably would not be recommended to take a drug. Antibacterials and antifungals do not show a clear effect of accelerating the clearance of an asymptomatic carrier. Again, speak to your doctor. But as a general rule, antibiotics should not be prescribed for a viral infection. She should quarantine if she has been tested and found to be shedding the virus. The question then becomes, how long should she quarantine? The general rule is for coronavirus and even influenza, 2 or 3 weeks may be necessary before the shedding stops. Most people, depending on when they are in the infection cycle, are done within 14 days. It really depends on the patient's situation, her general health, and the state of her immune system. Some people get sicker, and some people never show any symptoms at all. 14 days is the general rule, and then she should consult her doctor to see if she needs another test or if she's fine.
The rest of the questions are concerning animals and the coronavirus. Is there a chance the virus can end up in our food chain animals like cows, pigs, and chickens?
If it's a case where the virus is capable of getting into pets, cats and dogs, it could end up in food animals. The probability of it creating a problem is very small. I would suggest that since the food animals are provided to you in a refrigerated case, it's not going to be a case of having them transmit the virus to people. Also, if you handle the food and then wash your hands before cooking it, the cooked food is not going to be a problem. And proper hygiene remains a standard practice for anyone handling meats. That would go for salmonella as well and any other foodborne contagion.
There are now cases of COVID-19 in animals, dogs, and cats. Is there any evidence that animals can transmit the virus?
So the concern about coronavirus in dogs and cats and other pets is a real possibility, but there's no evidence yet that it's been transmitted from dogs and other pets to people. There is a possibility that if, for example, your dog or cat are outside, that they may transmit it to another dog or cat. And with that, you'd have increased presence of the virus in the community. So we should be aware of that and, as best as possible, take care of our pets and keep them in as well. That's kind of difficult for certain animals like cats that are nocturnal, but if you can, keep them in.
If you would like to learn more about the coronavirus in pets, the FDA released a document with questions and answers regarding COVID-19 in pets, and you can find it on our website. For the past few months, we have been answering all the questions that you've been sending in. You can find any of the early episodes on our YouTube channel. To make sure that you never miss when a new episode is published, subscribe to our channel and you'll get a notification when a new video is uploaded. If you have any questions that you would like our scientists to answer, you can fill out our fact check form on our website at www.eagleanalytical.com/COVID-19.